I'm not sure on this new phone. It's right here.
Oh,
I think.
okay.
Right here. I have to do this, guys, because I don't know
where we're looking.
This is a new phone I got. So, well, welcome to this little episode about plantar fasciitis with Dr. Kayla. One of the things that I will always say to you all that are in this group, I am not an expert in anything other than my own self. And sometimes I still wonder about that. But when you have a question about health, something health related, and I'm going to be honest, if I'm not really excited about it, if it's not something I want to learn about, I'm going to find a resource or someone that can explain it better than I can just by reading it. Something that you would do would just be Google or whatever. And so I invited Dr. Kayla to come on today and share with you some things about plantar fasciitis, what it is, how you can treat it, how to prevent, all the questions that you have. Now, if a question comes up while she's sharing, please put it in the comments. I'm going to be monitoring the comments so that I can share that with her and she can try and answer your questions as we go. So she's not going to read any of the comments. She's just going to talk, and then I'll hopefully see what you have to say. Okay?
Okay.
Welcome.
All right. Well, first of all, I'm Dr. Kayla. I work at Fresh Start Chiropractic Center in Macklehattan, and I am a chiropractor. So whenever I am going to talk about plantar fasciitis, I'm definitely going to come from the more natural approach rather than the medical. So just a fair warning. But let's start off with just what is plantar fasciitis. Most people know that it is foot pain, but what is causing it? So the plantar fascia is a really thin tissue on the bottom of your foot, and it goes the whole way on the bottom of your foot, but it also attaches to the Achilles tendon and goes into the calf muscle. So what can cause this? First, and probably the most common thing I would say, are fallen arches. So as we start to age, put more weight on our feet, just overuse over time, those things can injure the ankle, can stretch out that plantar fascia, and can cause those arches to start falling. Whenever those arches start to fall, it really spreads out the bottom of the foot and it overstretches that plantar fascia and can cause that inflammation type of pain. And that's what really causes the pain, is that inflammation. Sometimes if it's severe, it can actually cause small tears in the plantar fascia, and that can cause even more pain. I will say that people that have had foot or ankle injuries usually have more problems with plantar fascia. I sprained my ankle in college, and in that one foot, I usually have plantar fascia type pain. And that's usually because whenever you sprain your ankle, you're stretching out those ligaments and tendons, and that is as well causing the arches to fall, ultimately causing the plantar fascia to be angry. Overuse. So whenever you start a new exercise program, brand new, sometimes that is a shock to the system and a shock to your foot. So sometimes overuse can be a cause. Even if you are an athlete and you kind of step it up a notch, if you're kind of a 5K'er and you decide to start practicing for a full marathon, that can also cause plantar fascia. Pregnancy is actually kind of a common one, just because whenever you're pregnant, your ligaments are loosening and it's flattening out the foot, and it's also causing that overstretching of the plantar fascia. And then being overweight. Also with pregnancy, you gain weight, but also just overweight in general. It just puts a lot more pressure on the bottom of the foot and ultimately stretching out that plantar fascia, causing pain. So what are the best treatments? If you are having an acute flare-up, ice therapy is always a really easy one, a really good one. It's inflammation-based, so you want to calm down that inflammation so the pain goes away. So the easiest way to do it is to throw a water bottle in your freezer, freeze it, and you can actually roll your foot on top of it. So it's not only icing your foot, but it's also gently massaging it. The water bottle is usually pretty thick, so you usually don't get too much overstretching with it. So if you do that for 15 minutes, 3 times a day whenever you're having an acute flare-up, that can be a really good way to calm that pain down. Stretches and exercises, I'll kind of get into that more later. Lori thankfully wrote down some questions for me, so I'm following a guideline.
If you have anything else as it comes up, just
yeah,
pop it in.
Of course,
I have it here beside me. So,
but I am going to go over stretches and exercises at the end, so keep that in mind. Rest. Definitely, if you are weight bearing, it is going to aggravate it every time you are weight bearing. So if it is something that you're suffering with, if it's painful, you do want to take some time off. So whether that be skip a few workouts, modify your workouts, just really kind of give yourself time to rest until the flare up goes down, and then we can talk about stretches and exercises after that. And then arch support. If your arches are fallen and you wear good supportive shoes, that can really help calm down the flare up as well. If you think about it, if your foot is overstretched and you put an arch support underneath it, it's going to take that stretch out and it's going to really support it and help the pain go away. So that kind of answers the question, whenever I do have a flare-up, should I rest? Should I not work out? I really want to work out. You're going to ultimately kind of drag out the process if you continue to work out. So rest is really crucial during this time. Some people kind of live with chronic plantar fasciitis. So if that is an issue, you can kind of modify your workouts more than kind of just sit back with your feet up kind of thing. But if you're having a really acute flare-up where every morning you're in pain, the longer the day goes on you're in pain, you really need to kind of stay off your feet for a little bit. Whenever it comes to healing time, it really is kind of different for everyone. It depends on, is it from an injury? Is it kind of a chronic thing? How long has it been going on? I've met people that have had it for months and months and months. So it really depends on the person. And it also depends on what kind of treatments you're doing. If you are not doing any sort of treatment, it's really not going to get better in a quick amount of time. But I would usually say that if you're really working on getting it treated, icing, stretching, exercising, maybe doing some arch supports, it usually takes like 2 to 4 weeks and you're feeling pretty good. So it just depends on the person. I don't want to get anyone's hopes up, but 2 to 4 weeks is usually pretty reasonable. Will it come back? It can come back if you are not consistent with the exercises, the stretches. If you only do a diet for a day or if you only work out for a day and you get really good results, those results aren't going to last. It's the same exact thing with plantar fasciitis. If you don't keep up with it, it may come back. Preventative measures. Okay, so this is where we're going to get into the stretches and exercises. So stretches that you can do. As we already mentioned, the plantar fascia is connected to the Achilles tendon, and that goes up into the calf muscle. So if your calf muscle is tight, that can actually kind of tug on the plantar fascia and cause it to be worse. So calf stretches are a really good way to start stretching that area. Putting your foot against the wall, kind of hanging your heel off of a step. Be very cautious at first because it is going to be pretty sore. Kind of ease into it. But calf stretches are a really good way to start that process. Whenever it comes to stretches, I usually tell people hold things for like 5, 10, 15 seconds and try to do it several times a day. The more you're stretching, the more you're going to treat it. As well as the calves, the whole body is connected, so you have to think up the chain too. If your hamstrings are really tight, it is also going to cause some lower leg stuff. So if your hamstrings are tight, which everyone's hamstrings are tight, goodness gracious, we sit, we stand, we walk, we use hamstrings every single day, and not a lot of us stretch them. So if your hamstrings are tight, you should be stretching them, especially if you have plantar fasciitis. Foam rolling is another option you can do if stretching isn't enough. Foam rolling is a little bit more intense.
A little more is a lot more.
If you've never tried it, definitely ease into it. But if you feel like stretching is just not hitting it, not enough, you can try foam rolling the calves and the hamstrings. And also with the frozen water bottle, that's kind of like foam rolling for your plantar fascia. So we already talked about the frozen water bottle. Whenever you are out of that really painful spot, so you know what I'm talking about if you've ever had plantar fasciitis, just standing on your feet is really painful. Once you're kind of out of that with the frozen water bottle, the next step would be to step it up to a tennis ball. So if you take a tennis ball, it has a little bit of give to it, you can put it under your foot, roll it around. It's just a gentle massage for that fascia. And then once you are above the tennis ball, you can get to a golf ball. But you know how hard a golf ball is.
Imagine how that
So
would feel.
don't start with a golf ball. Kind of take steps up. But it really is just meant to massage the area. Avoid walking barefoot. So if you do have plantar fasciitis, like we said, it's an overstretching of that fascia. So if you are walking without arch supports, if you're walking on bare feet, it is definitely going to aggravate it. That's why people have a lot of pain in the mornings. Those tissues get really cold at night because you haven't been walking on them, and you wake up to go to the bathroom in the morning and you're stepping and stretching that out right away, and it's very, very painful in the morning. So what I tell people is if you can put maybe like a soft pair of slippers by the bed, even if you're waking up in the middle of the night to go to the bathroom, slip those slippers on to give yourself some cushion to walk to the bathroom. If you're not kind of giving that kind of shock to the system in the morning, it is going to make it better throughout the day. If you have shoes that have good arch supports, those are what you want to wear throughout the day. So flip-flops, goodness gracious, if you have flip-flops that don't have arch supports, please don't wear flip-flops. They are starting to make really good solid sandals, like the Birkenstocks, that kind of thing. Mm-hmm. Those are usually pretty helpful for people that do have plantar fasciitis. So those are the type of things that you want to look for.
Is there any specific brands that you would recommend other than Birks or that you know of? I mean, I don't mean to interrupt you, but...
No, that's okay. Not in particular. We do have at the office, we can make you custom sandals, which would make you arch supports that are specific to you, which are nice. Especially whenever it comes to sandals, there aren't a lot of sandals with arch supports. So if Birks aren't working, you could go that direction. There are other brands that do have arch supports. I'm just not familiar with them.
You have something locally for people that
but you do have to keep in mind that like with Birkenstocks, that is an arch support that is the same for absolutely everyone. So if those aren't cutting it, you have to look into like custom stuff. Better shoes. Mm-hmm. If you've never been to Rapid Transit up in State College, they are a really good place to start. They are right downtown.
And there's also a place in Williamsport called Elite Feet.
Yes, Elite Feet.
There's the other one there too. So wherever you, and I know there are some people in here that don't live in Pennsylvania. So find a place that does custom fitting of tennis shoes, sneakers, whatever you call them.
Ask around in your gym. Ask around if you're a runner. The runners know where those places are.
They do.
But they basically take you in and they measure your foot with the old metal. I don't even know what you would call it.
Shoe sizer.
A lot of people aren't wearing the right size shoe for their foot. So they measure your foot, making sure that they know specifically what size you're wearing, and then they bring a whole bunch of shoes out and they try them on for you, and you walk or run in them to make sure that your ankles are supported, your feet aren't rolling in, that type of thing. So if you are having problems with finding proper shoes, find a place like that. And they will really, really help you.
So that was Rapid Transit in State College, for those of you that live in Pennsylvania and local, or Elite Feet in Williams. I think it's right in Williamsport somewhere.
Yeah, I believe so. Yeah, I've never been to that one, but
I'm thinking it's by the Golden Strip is where I'm thinking, but I could be totally wrong. Like where Bonanza used to be.
Yeah, I've never been to Elite Feet, but I've heard good things about them.
So check them out.
And then if you've kind of run through the gamut and nothing's really helping, there are custom orthotics. So we make them at the office. We scan your feet, and the orthotics come in the mail. We can make changes to them if you're not happy with them. There is also a lady that I have sent people to. She's awesome. Her name is Kristen Lindquist. She's in Pleasant Gap. And she makes molds of your feet and makes orthotics that way as well. I will warn you, if you call, she is like booked out for months. So, but she's fabulous. I mean, she's really, really great. Right. So those are some options for you whenever it comes to treatment. Okay, strengthening the foot and ankle. So we talked about how fallen arches can cause the plantar fascia to stretch and cause that inflammation. So if you are strengthening your foot and ankle, sometimes that can help strengthen the area so it's not flattening out. So whenever it comes to range of motion, if you think about pointing your foot and pulling your toes back towards your face, those are good ways to strengthen two parts of your ankle. Pointing and flexing, yes. So a good way to exercise that is if you have bands or tubing, you can put around your ankle. If you aren't that sophisticated, that's fine. I'm not either. You can just put a little towel around your foot and kind of use your arm strength, but you want to resist that. So you're going to put a towel around the bottom of your foot and you're going to pull back and resist, and you're going to push against that resistance to get some strength. And then also your ankle goes side to side. And those are also two ways that you want to strengthen your ankle. You want to strengthen your ankle the whole way around to keep those arches from falling. So you would do the same thing. You would put tubing or those bands around the side, and you would kind of point your toes to the side and then point your toes out. There's not a lot of range of motion in those directions. So just keep that in mind if you get a little frustrated. But then also to exercise the bottom of your foot, if you take a towel or a blanket, you can put it flat on the floor and put your foot on top, and you're going to scrunch your toes. So you're going to pull your toes in towards the center of your foot, and that is going to be a really good exercise for you as well. And then will strengthening help with prevention? Like everything, if you do it consistently, it will, but you have to be consistent. So whenever I say consistency, you're definitely going to have to, whenever you're in acute phase, you're definitely going to have to do these like 3 times a day, and be faithful to it, and you will see a difference. But those are the natural ways that you can help plantar fasciitis.
There is one question that I see. What do you do if the Achilles tendon is inflamed as well?
Yes, so that's actually pretty common because they are connected. So whenever it comes to the tendon, it's going up the back of your ankle. So you're definitely going to have to ice there. So you can wrap an ice pack around there. But it's going to be very similar to the things that we talked about with the foot. You're definitely going to want to support that ankle. So if your shoe is not doing enough of that, you might want to wear kind of like an ankle sleeve for a little bit, and that's just going to prevent it from kind of shifting in your shoe and kind of aggravating it even more. And the same thing is just rest. You're really going to have to rest it, and that's what the sleeve is going to do too. You can't always stay off of your foot, so if you do have to walk somewhere, rest, ice, brace it.
Now, other than like doing the exercises at home and doing the icing and maybe getting orthotics, is there something chiropractic that you can do for anybody with that type of an ailment?
So whenever someone comes into the office and they're complaining of plantar fasciitis, I always adjust their foot and ankle. There are a lot of small bones in the ankle and the foot that can shift. So definitely adjusting the foot is going to help the healing process. But I always add all the other stuff to it, just because it all works together really well.
Right. And sometimes it takes more than one thing. You have to try more than one thing and be consistent at it to see what's going to work best for you. And that's in anything, whether it's fitness, whether it's nutrition, whether it's mindset work, whatever. As we've talked about a lot over the course of the 5 years I've had this group, there's consistency is key to a lot of different things, and you all know that. So there's no other questions here, but please, if you are someone who's watching the replay and there are some questions that come up that Dr. Kayla didn't answer for you, which she gave us a ton of information. I think she covered it all. I didn't have any questions in that other than where can you get the things that you need. Please feel free to drop them in the comments of this video and tag me so that I can let her know. And she's also in this group, so if you want to tag her as well, she'll get a notification that you have a question for her. Do you want to tell them where they can find you again?
Yes.
So that in case they wanted to meet you in person.
Yeah, if you want to meet me in person, so I am Dr. Kayla Wagner, and I am at Fresh Start Chiropractic and Wellness Center, and we are off the McElhatton exit in technically Lock Haven, but we are there. And if you would be interested in looking into custom orthotics, we do free foot scans, so you could just call the office, set up an appointment. It's about 10-15 minutes. We just scan the bottom of your foot, and then we can talk more about your orthotic options.
And what's your business hours?
Okay, so office hours are very different every day, but definitely daytime hours. We start at 9 o'clock in the morning. We take a lunch break usually around 12-1, and then just depending on the day, Tuesdays and Thursdays we're there until 7. Mondays and Fridays we're usually there until 5:30, just depending on the day. Wednesdays we're only there every other day. That's why I'm here.
Yeah.
So just call the office and we can help you out.
Yeah. And there's a lot of other great things at Fresh Start Chiropractic. I've been going there for, I can't even tell you how many years I've been visiting there. And Dr. Fawn and Dr. Kayla keep adding more things to help you stay away from medications and things like that until that's the last resort.
Yeah.
So.
I will say that we also do use cold laser therapy on people's feet. It is really great for inflammation. So if you have a chiropractor, I know that some physical therapists are starting to get into it. They're very popular right now because they're very effective. So that is also something that can help with your treatment as well. And we do have one at the office. So
and I have a personal anecdote about that.
Yeah.
I had been doing one of Shaun T's workouts in the backyard, and I didn't assess the area first. Don't ever do that. If you want to work out outside, assess the area, make sure there's no little dips and everything. And I rolled my ankle, and I think it was the ankle that I had sprained years prior so badly that I thought, oh my gosh, because this is me, it's hanging off my leg, right?
We always think that, right?
I'm going to look down and it's going to be like crooked and sideways or turned around or whatever. And I felt that tingle of the nerve, and I thought, oh boy, I've really done it. So I called Dr. Fawn, and it was, of course, right before a holiday weekend. And she said, come down to the office. We're going to be closed all weekend. You can she let me take the laser home.
Oh, perfect.
And I'm telling you, my ankle was like, someone had stuck a pumpkin on the side of it. I did it all weekend faithfully. I was so consistent, set my timer and everything on my phone. And by that third day, all of my inflammation was gone. It really did work. But
it's
you
crazy
have
how good it works.
Again, you can't just do it once and go, it's not like it's not like a witch doctor, but you have to be consistent with these treatments. But I didn't take any medication during that time.
Wow.
But I did watch what I was eating. I kind of tailored that too. I mean, I took turmeric and all the other things too, but that so helped me. I mean, 3 days and it was gone.
That's awesome.
It was awesome.
Quick for a
second. Yeah, that was quick. And I still had to kind of take my time, and I still rested that following week because it was a bad one, but there was no inflammation. It was gone.
Wow.
That was cool. Yeah. So
cold laser works.
Yeah, it does. It does work. All right, ladies, thank you for tuning in live. And if you're catching the replay, let us know in the comments too. Just say replay. And again, if you have any questions, just put them in the comments, tag me or Dr. Kayla, and we'll get you the answers to those as soon as we can. Thank you for tuning in. And if you have any other topics that you would like myself or even Dr. Kayla to share with you, let us know and we'll make it happen. All right. Thanks, ladies. Have a great day.